Hello and thank you for tuning in. My name is Dr. James Galloway and I'm presenting the results of the case of the conference from the Rheumatology Journal for EULAR 2016. So, for those of you that remember and took part, the case is shown in the graphic adjacent here, which is a radiograph of someone with bilateral auricular calcification. The options available included hypothyroidism, relapsing polychondritis and systemic sclerosis. And congratulations for those of you that went for relapsing polychondritis, was the correct answer. Systemic sclerosis can of course cause ectopic calcification, although it is normally digital and focal in nature, that calcinosis appearance that we're all familiar with. Hypothyroidism, you could have been forgiven for answering that, as there have been rare cases of hypothyroidism associated with calcification of the auricular cartilage, although it is more commonly in the context with hypopituitarism. If you were to look onto the New England Journal of Medicine website, our competitors, of course I wouldn't necessarily advocate that, but the 2011 case report they present with very similar imaging of a patient with bilateral auricular calcification was someone who had hypophysitis and also quite significant hypoadrenalism. And there are, of course, other cases of auricular calcification not mentioned here, for example, frostbite, although the diagnosis there is normally more obvious. So relapsing polychondritis was the correct answer. Very unusual disease, affects an estimated 3 to 4 per million of Caucasian population. First described some nearly 100 years ago in 1923 by Vortenhorst, who did, as you would expect, describe a patient with episodic inflammation of the nasal and auricular cartilages. The case we show you here was presented by Iona Thorne, who's from Barts in London. Thank you very much for submitting it. A 29-year-old woman with around a 9-year history of episodic inflammation of the nasal and auricular cartilage, and radiographs as shown. So, well done again to all those who got it correct, and I hope if you didn't, you'll go and have a look at the case that was published online and in our journal. Thank you very much.